You guys need to be extra prepared, like I've been telling you. When they start saying nursing home and a hospital, don't put all your eggs in that basket. Be prepared to take your loved one home. Nursing homes are going through staffing shortages because the government has now changed the way that they have to have full-time RNs there 24/7. Henry Mason, CEO of Precious Hospice. This is not surprising to me. I've been saying for a year now, nursing homes were changing because I have people that I could not find beds for. And I'm like, man, I'm healthcare Henry. Clearly I can find a bed. And no, literally, it was so complicated to find people a bed. I had to start doing my own research and saying, why is it that these nursing homes no longer want patients who need a bed? If that's how they make money. And that's when I rolled upon the nursing home model of rehab versus long-term care. And so what they've done fundamentally is they've said you can use rehab beds and don't have to use as many long-term care beds because this bed pays $15,000 a month and this bed pays $4,400 a month. And you can kind of determine on your own who needs what bed. But the idea that you no longer need a full-time nurse means that these beds are no longer that much more available. I have a huge problem with this. I talk about Atlanta a lot because our office, the corporate office is there. And even today I'm riding through and you have an insane homeless population. Unnecessarily insane people just outside without home, without shelter, without homes to go to. And a lot of them don't have any help. They have high levels of acuity. They need a lot of help with skilled nursing. And so now these things no longer exist. And because you're going to pull their Medicaid, there's actually no one who can afford to help them. There's going to be no out-of-pocket program because they can't afford that. And the Medicaid programs, which, if we're being honest, have very little margins for most companies. That's why they're pulling out of it. You're figuring out, like, okay, what are these people actually going to do? I don't know. I would love to see how I could become a part of that conversation. I don't see why you guys are having conversations and not including people who actually know what's going on. Ding, ding, ding. That's another one for me. But hey, maybe we'll figure something out in the future. But if they do go through with this, which they've pretty much done, you guys need to be extra prepared. Like I've been telling you, when they start saying nursing home and a hospital, don't put all your eggs in that basket. Be prepared to take your loved one home. And then hopefully, if they need another service, you can add that service to it, whether it be home health or hospice. But if not, you got to be prepared to take care of them. Let me know what your thoughts are and if I can help you in the comments.